Presenting a male 30, a rare case of acute dystonia after prochlorperazine IM or oral tablets after STP surgery on the right side. This patient present to us with upward deviation of eye, twisting of neck, tongue protrusion, difficulty in speaking, and arching of the neck backwards. This is a classical case of the acute dystonia. And there is also buccolingual crisis. There is difficulty in speaking and tongue protrusion. This is known as buccolingual crisis, and this case is because of prochlorperazine injection or oral tablets medication. We are routinely using these medicines in the STP surgery, intra-op and postoperative management of giddiness. Acute dystonia is a movement disorder characterized by sudden, involuntary and sustained muscle contraction that causes abnormal posture and repetitive movements, and it is often side effect of certain medication, particularly antipsychotics and antiemetics. Acute dystonia results from imbalance between dopaminergic and cholinergic pathway in the brain, particularly in the basal ganglia. It is primarily associated with reduction in dopaminergic activity in the nigrostriatal pathway, which lead to overactivity of cholinergic neurons. This imbalance can triggered by drugs that block dopamine receptors, especially D2 receptors. Etiology and risk factor. Medications like antipsychotic, antiemetics, antidepressant, anticonvulsants, and antimalarial. These may lead to these acute dystonia-like symptoms. Risk factor may be young patient, male are more often on high risk. Drug, if given in higher doses, some patient may have genetic history, and other symptoms seem like agitation or other depressive disorder may are high risk cases. Clinical presentation. Onset. Symptoms usually develop within hours to days of starting the offending medication or after a dose increase. Common manifestations are oculogyric crisis, upward deviation of eyes, torticollis, twisting of the neck, buccolingual crisis, tongue protrusion and difficulty speaking, opisthotonus, arching of the back, laryngospasm can cause respiratory distress. These are the clinical presentation. Diagnosis is mainly clinical, based on history of medication use and characteristic symptoms. Exclusion of other causes like structural brain damage and electrolyte imbalance. There is no specific lab test for this acute dystonia by medication. Management include immediate discontinuation of offending agent, pharmacological treatment including anticholinergic like benztropine or diphenhydramine. Benzodiazepine drugs, diazepam, lorazepam can provide symptomatic relief. Reversal with dopaminergic agent like amantadine. Supportive care in laryngospasm cases and reassurance. Most of the cases resolve quickly after treatment initiation and stopping the offending agent. Prevention. Careful medication management like use lowest effective medication, gradual dose titration, prophylactic use of anticholinergic than the antipsychotic. Patient education about the drug side effect and consent should be taken about dystonia. Prognosis. Most cases resolve completely with prompt treatment. Recurrence is possible, especially if offending drug is not continued if other similar agents are used. Chronic dystonia may develop with prolonged exposure to causative medication, though this is less common with acute presentation. On conclusion, acute dystonia is distressing but usually reversible condition. Prompt recognition and treatment are crucial to alleviate symptoms and prevent complication. Awareness of medication that can trigger acute dystonia, understanding patient risk factor, and knowing how to manage acute episodes are essential skill of healthcare providers. So, takeaway messages are acute dystonia often presents suddenly and is most commonly triggered by certain antipsychotic or antiemetic drugs. The condition results from dopaminergic cholinergic imbalance in the basal ganglia. Management include discontinuation of offending agent, administration of anticholinergic medication, and supportive care. Prevention involve careful medication management and patient education.